Good afternoon, everyone. We're really excited to welcome you here this afternoon to Elara Home Health here on Fulton, right next door to the chamber. It was a lot of traffic getting here for us today, for sure. No, you are our great neighbors. We love having you here in our community. I'm joined today by Brandy Selican, who is the administrator of Elara. Brandy, welcome. We're very excited to have you in our community.
We're excited to be here.
Yeah, absolutely. Brady, tell us a little bit about Elara Home Health's mission and the services you provide to the Garden City community.
We provide skilled home health services to the community of Garden City and 10 other counties in southwest Kansas. We provide skilled nursing, physical therapy, and home health aid services for patients that may have just been hospitalized and discharged, have joint replacement surgery, newly diagnosed diabetics or congestive heart failure patients. We have some specialty programs for incontinence rehab. They have fun little names. Roll for Control, Mindful, what is it? Matters, for behavioral health and mental health issues. We do a lot of care for Alzheimer's patients, patients with other neurological deficits, cerebral palsy, Parkinson's. We have a lot of Parkinson's patients, MS, just anything that would require a stay in like a skilled nursing facility, we can provide for you in your home.
Fantastic. So I know Elara, the name is relatively new to our community. What inspired Elara to expand into Garden City?
Well, many years ago, Ed Schulte was working as the assisted living director for Midwest Health, who owns the ranch house and homestead here in Garden City. And he saw a need for expanded home health services in Garden City. Fast forward to 2019, we opened our agency. Then last year, Ed decided it was time to retire. So we started interviewing potential buyers. We were not going to just be sold to the highest bidder. We wanted to find a buyer that matched our mission and values, who put the patient first. And lo and behold, we found they were our third attempt, we found Elara. And they so far have been an amazing company. They truly do put the patients first. They care about the employees as much as they care about the patients, and it's been a very, very good match. So we're excited that Elara, before Garden City, they had not had home health services in Kansas, but they cover many different service lines. They have behavioral health, palliative care, hospice, home health, and personal care attendant. And so we are in 18 different states. We have 200 plus offices, but we are the furthest west from the East Coast.
Okay.
So wow. They're a big corporation. That's been a little bit of a change for us, but they were the right one, and we're excited to be a part of them.
That's great. It sounds like they really are a great fit for our community. I know you mentioned a little bit about the services you provide for your clients. Any other programs or services that you provide that you want to let Garden City know about?
Like I said, we have some specialty programs. We haven't been trained on all of them. It was a big changeover to go from one system to the next. And so they're still trying to integrate us into some of that stuff. We have specialty programs such as the Engage and Monitor program. The Engage program actually makes phone calls to our current patients between visits. So they may have a PT visit on Monday and a nurse visit on Thursday, but they'll get phone calls, especially our high-risk patients, to see if everything's going okay. We have a monitoring program, so we're able to provide telehealth services for patients with congestive heart failure, the need to be weighing themselves daily, and that needs to be monitored closely. We have a follow-up program where every patient that's discharged from our services will receive follow-up phone calls at 14 30, 60, 90, and 120 days to make sure that they're still doing okay.
Wonderful, great communication, absolutely.
Yeah.
So if a family or somebody is looking for services, for a family member, how do they reach out? How do they get started with Elara Home Health Care?
They can talk to their primary care physician. They can talk to their surgeon that's performing the orthopedic surgery or any other surgery, or they can just call us directly and we'll be glad to facilitate that for them.
Fantastic. Well, there's a lot of services that you definitely provide to the community, and we know it takes a great dedicated team. How about we take a minute to meet some of the team here at Elara, if don't mind introducing us to some of them.
I sure will.
And I'll let you pass this down to them.
This is Luann Fisher. She is one of our RNs.
Tori Howard. I'm one of the nurses that go out on the home visits and do some office work here.
She's our clinical team manager.
Holly Herrera, I'm an RN.
I'm Emily Wiles, I'm the PT.
We also have a physical therapy assistant who's out today. And then we have another, Alex Marquez. He is another one of our RNs. And Rommel Schlereth, he is an LPN that works for us. Oh, there's Rommel right there. And then we have the two best home health aides in the country. Yeah, a mother and daughter team. Cruz and Erica Lauber. They're kind of shy, but they are amazing. We truly are a team. We collaborate together to make sure that each discipline, whether it's home health aides, skilled nursing, physical therapy, that we're all working together to make sure the patient's taken care of and make sure the patient has the best outcome possible.
We love that. That is absolutely amazing. Well, like I said, you make great neighbors, not only for the chamber, but you are a great addition to our community. We're excited to have you here and wish you all the success. So if I can have the ambassadors come on up, we will go ahead and cut the ribbon and make this official. 3, 2, 1. Congratulations.